אתם מאזינים לרדיו הידברות 97.5 FM.
For an unparalleled Jewish radio experience, tune in to Radio Hidebrut 97.5 FM.
Hello, this is Dr. Jacques Dweck, and I'm inviting you to join us every Monday evening at 8 p.m. when I'll be hosting 97.5 Health Watch right here on Radio Hidebrut. Tonight, we'll be interviewing Dr. Brian Keropian, the inventor of the full breath appliance that's 97% effective in eliminating snoring. So if you or someone you know has a problem with snoring, tell them to tune in right now, Radio Hidebrut. It's 8 o'clock. We're getting started right now. I'm your host, Dr. Jacques Dweck. This is 97.5 Health Watch, and we're interviewing Dr. Brian Keropian, the inventor of an appliance that is 97% effective in eliminating snoring. Dr. Keropian, are you with us?
You bet I'm with you.
Okay, terrific. So let's get started talking a little bit about snoring. Now, you had mentioned to me when we spoke that you have many people complaining that their husbands, their wives, somebody's snoring.
You're not kidding. Well, the statistics are that come from the National Sleep Foundation, and that's the big group here in the United States that does so much work with snoring. They tell us that 100%, there's 100 million Americans that snore. Wow.
Wow. That's half of the population. How many Americans are there?
Well, there's like 360.
Okay.
350 million. But we're talking large percent, 56% of the adult population.
Wow.
That's what that is.
Wow.
And snores. And with that comes all the problems in the household and the disharmony that comes from the noise. The wife is unhappy. She can't sleep. The kids, they get the teenage kids. They're joking with dad and giving him sticking the needle at him, giving him a little trouble. The grandkids are giving grandma or grandpa trouble. And what I really am sometimes amazed about is all of a sudden grandma slept with little Sadie last night. And little Sadie's 5 years old, and she gets up and says, "Grandma, you were snoring." Grandma gets whiplash looking for a place on what she can do about her snoring.
Right. So what do people usually do about snoring? I mean, I know people have told me that, they snore and they try different things. I know that people go to the pharmacy and they go on the internet and they try to purchase something. How effective are these devices that people are using for snoring?
Well, all these things we're talking about everything from various medications to the mouthpieces that you see on the internet for, $60, $70, to various homeopathic remedies. Those don't work. The snoring is caused because as you're sleeping, the tongue rolls backwards. And it rolls back and closes the airway. And that's a scary thought. It closes the airway about 80% of the way. So there's 20% of the airways open. Now, for the air to get through that little 20%, it goes up through the nose, comes down the back of the nose, into the throat, and gets right where the tongue fits against the back of the mouth. Now it's only a 20% opening. But through physics, the air speeds up, and that rapid-moving air vibrates everything inside the back of the throat, and guess what you get?
Exactly.
Big snore noise. So if you can do something to keep that tongue forward, and there are a number of things that can be done, some more successful than others, some highly rejected, and then we have what I think is the most successful and the most accepted.
Well, I know as a dentist, I have tried to help people with snore appliances, and basically what we try to do is sort of push the lower jaw forward to give them some more room in there. But I found that every time I've done that, the patient was complaining that their jaw would hurt them in the morning.
Well, see, that's dentistry's big answer. is move the lower jaw forward, jut it forward, and if you bring it forward a quarter of an inch, a half inch, as much, even a little more than a half inch, I mean, really as much as you can do it, it pulls the tongue forward, theoretically. But one of the things that happens with that is you get jaw pain. The side of the face hurts, the jaw joints hurt, people get headaches from there, and then every once in a while the jaw gets stuck partially forward. Nightmare. Now the bite's off, your cosmetics have been compromised. It is not a pretty picture when that happens. And that is one of the reasons I developed what I did. I did not like pulling the jaw forward. And there's so many dentists like you, Doc, that have worked with pulling the jaw forward, and they don't like it.
Exactly.
And that's, dental appliances have been around for about 15, 20 years. And in all reality, they have not gained a big foothold in treating this because, one, the dental community is not in love with them, and two, the public isn't in love with them. And then we've come along with, as you know, a whole different way of treating.
Right now, I've seen other types of appliances with they put something on the nose, like a tape or something. Have you seen any of that?
That's not necessarily an appliance. They do have the Breathe Right strips that fit over the nose to try to shrink. There's something called turbinates in the middle of the nose. They're like sponges,
right?
And they filter out the bacteria, but they can swell and get big. And as they get big, it's just harder to breathe the air in. But I don't care how much you close the nose up, or open the nose up, if the tongue goes backwards 80% to 100%, and 100% is what causes the sleep apnea, is that the airway being blocked by the tongue, no matter how much air is coming through the nose, it's not getting down.
Okay, so I need to just let everybody know that we are, right now, 97.5 Radio Hit Da Brut. We're listening to Dr. Brian Keropian. He's the inventor of the Full Breath Solution, a device that's made to help people who snore stop snoring. And it's a very exciting technology, and I'm very excited to have him here with us. So you're listening to Dr. Jacques Dweck, interviewing with Dr. Brian Keropian on Radio Hit Da Brut 97.5. Health Watch is the name of our show. Brian, so let's get really down to it now. You've designed this appliance. How does this thing actually work, and what makes it so much better than everything else that the dentists have tried and people have tried from the pharmacy and on the internet?
Well, okay, all those. So let's say someone buys a $60 appliance on the internet. One of the problems is they're big, they're horsey and bulky. That they don't like.
Well, because they're not really custom fit.
No, it's not. You're absolutely correct. And now you put it in warm water, put it over your teeth, and jut your jaw forward, so that it will that warmed rubber, the rubber that you warmed in hot water, will now get hard, and the bite will now be forward. Well, all the problems that you talked about, pulling the jaw forward and moving it forward and causing pain, are there. But if you do it and if snoring doesn't stop, now what? You're dead. And that's kind of the story. Not to say that none of them work, because you do get some success, but it's a low percentage success.
Right.
And if you go and get a appliance from another dentist that does that, you look at all these same probabilities from occurring. The jaw pain and the tongue still rolling backwards. Now, what we do is we have a lower appliance, a lower mouthpiece that has plastic that covers all the teeth from the very right back molar all the way, making a horseshoe, swinging around in front, going all the way to the back left, covers the teeth all the way. It's
pretty much
right over the
much
teeth.
Like a bite guard that someone would wear for TMJ.
Right. For all your listeners who grind or clench their teeth, Well, heck, if you're living in New York, come on.
Exactly.
You know you're stressed. I had to throw an LA joke in there. Then there is a bar that runs from the left to the right, from the left molar to the right molar, at the back, either first or second molar. So it goes across the tongue. It makes a little canopy over the tongue. Well, that's nice, and that canopy is to kind of restrain the tongue from going up and back. But then in the middle of that canopy is a little tail that goes back quarter of an inch, a half an inch, and you do it slowly. You put that on so it's comfortable for each person, and you have it sitting above the tongue. And that is going to restrain and inhibit the tongue from going up and back.
So basically, for a person who has not seen this appliance, but they're familiar with bite guards, it looks like a bite guard with a piece of plastic across the back molars that pushes that tongue down just enough to allow the air to go in there so that you stop snoring. Is that what I'm understanding?
That's exactly correct. And what we end up doing is once they've worn it for a couple of weeks, we'll then put a little wax underneath the tail, that tail that goes back. And the tail's like a half an inch wide and goes back a quarter of an inch to a half an inch. And we'll put a little wax, have you try that, see how does that feel, doesn't feel bad. Now we'll change it to plastic. So now we start to push down on the tongue, depress the tongue. Well, that's what the MD does to look at your tonsils and your throat. You go in for an exam, he puts the little tongue blade in, the little tongue depressor, pushes down, and then he can look at your tongue. So we're putting a tongue depressor in the mouth that you sleep with comfortably. That's got to be stressed.
That's the key. The key is to be comfortable, because nobody wants to do something that they're uncomfortable with all night. They'll take it out of their mouth and they won't put it back in.
You are 100% correct. So that's exactly what we do. And as you know from a guy who does this, that we take our time establishing the comfort. Some people, it's amazing. It's like one person can wear tight glasses, the other needs their glasses so loose. I mean, they're all but falling out. Well, the same thing with this. One person needs the tail so short because they can't take anything more, and the next one needs it an inch and a half long. I mean, it was shocking. And everyone is different as to what they can take, and so it takes people like you and I to set it up so that we get the right formula for each individual. But boy, are we successful at stopping snoring. And people are so happy that we can do that. I mean, we haven't even talked about the fact that that if the airway is cut down 80% and you're only getting 20% air, that you're getting your cells, the cells need food, water, and air. And if the cells of the body don't get those three, there's going to be a problem. So when you get a reduction of the air, the cells of the body start to break down. And in essence, you're on a slow train going downhill, representing your body slowly breaking down. And in 2 years, 5 years, 10 years, you could be sitting in medical waiting rooms because your body is breaking down.
So what you're talking about, Brian, Dr. Keropian, what you're talking about is the transition from just snoring to sleep apnea, it sounds like.
Well, yes, but remember, if you're snoring a lot, you're also getting reduced air. If
automatically,
you get sleep
no matter
apnea,
what.
You're getting reduced air where there's no air going in 10, 20, 40, 50 times an hour, 25 seconds a pop. With the snoring, you're snoring 30, 40, 50% of the night, you're getting reduced air where only 20% air is going in instead of 100%.
Right. So, and that's the reason that a lot of people are tired during the day, because they didn't get that full night's oxygenation.
Boy, did you hit the nail on the head? Everybody is tired. Everybody is under stress. Everybody is working hard, and they're all tired.
So now, somebody who snores, how should they suspect that they have sleep apnea?
Well, yes. I mean, snoring is an indication that you have a high probability of sleep apnea. Not 100%, but we found it to be about 93% of the people who snore have mild sleep apnea or worse. 78% have moderate sleep apnea. Now, moderate sleep apnea says that your tongue is rolled backwards and blocked your airway at least 15 times an hour. So 15 times an hour. No air getting down to every cell in your body, 20, 30 seconds a pop. That's not good. I mean, it leaves you fatigued. It leaves your body in a state of the cells can't regenerate at night. It leaves you in a state that you're not nearly as able to fight off infection and disease. And you know what? We all age. And none of us, come on, we want to slow the aging process on all of us. So anything you can do to get more air, and air is the basic. It is basic for survival. And medical science only came up with the ability to treat sleep apnea in the last 20 years. And it got handed to dentistry. Well, you know, I mean, you can even discuss, what goes on with the CPAP.
Right. Well, first of all, let's just define what is sleep apnea and what are the signs that someone may have sleep apnea.
Okay. First of all, with sleep apnea, most likely someone's going to be snoring. So that's your first flag that maybe there's sleep apnea. What happens with sleep apnea? With snoring, the tongue goes back 80%. With sleep apnea, the tongue goes back 100%. Totally blocks the airway. And for it to be sleep apnea, for one event to happen, the tongue goes back at least 10 seconds, and it can be 10 seconds to 90 seconds. One sleep apnea event. You go get a sleep test, and there's centers all over New York, Manhattan, the Bronx, you name it, it's there. They're there. And you go, you spend the night, and they put little electrodes on you. They measure how many times you stop snoring like that an hour.
So wait, I have a question now. Some people can't even imagine themselves going into a sleep center. I had heard that there are home sleep studies that you can do, that you can go to a sleep center, get the equipment, and do it at home. Have you had anybody do that?
Oh, well, with lots of people. There's only one problem with that. If you have medical insurance or Medicare, you have to have it done at a sleep lab. Uh-huh. They will not accept the diagnostic study, the first one, at home. They will compensate for the follow-up study at the end, because let us assume you put a mouthpiece in somebody. You want to see what your success is. If they were stopping breathing 40 times an hour before, you want to see how many times they stop breathing afterwards with the mouthpiece. And you can use a home study for that.
Right. So we'll talk about the benefits of the sleep study in a minute. I just want to remind everybody, they're listening to 97.5 Health Watch, Radio Hit da Brut. I'm Dr. Jacques Dweck, your host, and I'm interviewing Dr. Brian Keropian. He's the inventor of the Full Breath appliance, an appliance that has been proven to be effective at eliminating snoring, and now we're discussing the benefits of treating sleep apnea with this same appliance. So one of the things that we mentioned is that if you want to treat sleep apnea, and if you are looking to get the right diagnosis, you need to go to a sleep center. And Dr. Keropian, you mentioned that someone with insurance, they must have it done in a sleep center. And the benefit, again, is going to be that the insurance is going to cover the cost of the appliance.
Correct.
Which is a big benefit to
Well,
them.
at least cover anywhere from 50 to 90% of the cost of the appliance, of the treatment, of
Right.
the whole treatment
It's the
regimen.
appliance and the treatment that's involved.
Right.
So someone who has this heavy snoring, what other signs do they have? We mentioned a little bit that they may be a little bit drowsy. What other
fatigue.
symptoms may they have?
One, they can wake up feeling, God, I just slept all night and I feel like heck. In the afternoon, they get very tired. They really start to fall apart. And they could be, a lot of people who have bad health. The bad health is a big factor. People who've gone from doctor to doctor to doctor, and no one can find any reasons for their health breakdown. And these are doctors who aren't well schooled in sleep apnea. I mean, there are physicians who that's all they do, and then that's all they see, and that's what they recognize. And you and I, as dentists, I mean, that's all we recognize that. The other thing is this fatigue. I mean, this is a big thing. I mean, I've had some really interesting stories. I had a judge here in Los Angeles. He came in and he said, "You got to help me." He says, 3 o'clock in the afternoon, boring trial, boring witness. He says, "I am doing everything I can so I don't fall asleep at the bench." Whoa. Now, this guy had a real problem. He stopped breathing about 50 times an hour. So he was not getting enough air, and it was really showing up late in the day. I had another fellow who said that every Thursday they had a PowerPoint meeting at work. And it would be like they would have the whole department would be in. They'd have about 10, 15 people. He said he'd be sitting around the table. He said he'd fall asleep every time he started snoring. He says, "You got to help me. They're going to fire me if I don't stop this." And that's the kind of thing that we see. But so many people are tired at work, and pilots, and also the trucking industry. This is huge because of the long hours they keep. They snore, they are fatigued, and they get in accidents. So there's a real push by all industries where someone is in charge of a vehicle, whatever type it is, that they are being checked for sleep apnea. And it's just going to spread more and more.
Well, if you know, there are many people that, as they're commuting back and forth to work, they're just too tired.
You know what? You got it. I don't know the story, but I imagine on that whole side there where Brooklyn is and Queens and all that, and people are going back and forth to Manhattan, and the drive is a nice commute. People get tired.
They get tired. They get sleepy. They could fall asleep at the wheel. A big problem, people are traveling back and forth from New Jersey to New York, from New York to New Jersey, and it's a dark highway, and they get a little drowsy, and it's really frightening.
You know what? It is that aspect is very, very frightening. One, what you can do to someone else, and what you can do to yourself and family.
So we have two main signs of sleep apnea. One would be this excessive daytime drowsiness, or falling asleep, or just feeling very, very tired and worn out. And the other one is the loud snoring. And what about dry mouth? I know that some people have dry mouth because they take medications, but when you wake up in the morning with a very dry mouth, I know that I've asked people, do you sleep with your mouth open? And how is that? And now that I'm thinking about it, I would think that is another sign of sleep apnea.
Well, it's a potential sign, but you're absolutely right. They sleep with the mouth open, and a lot of people think with the mouth open, well, maybe the tongue is going to be bigger open. But what happens is it tends to fall back a little more.
I got it. So we talked a little bit about insurance and how it works. What usually happens if somebody thinks that they have sleep apnea? They're going to go to a sleep center to get a sleep study done, and they're basically going to sleep in this facility. I guess it's like a little mini hotel. How does that work?
It's exactly. It's a little mini motel. And what they have about anywhere from 2 to 6 bedrooms. Separate bedrooms with all your own privacy, and they've got the equipment in there, and you go to sleep. And I mean, it's a little tougher going to sleep because you've got little pieces of tape with little wires on eight on each side. And with that, it's a little more difficult to sleep, but people do get to sleep. And the test is taken then.
Right.
The info gathered.
Right. So based on that test, then, a diagnosis is made of either sleep apnea, moderate, mild, severe, or none at all. And then, based on that, the person would then go to the doctor who would be able to help him. Now, I know, like we mentioned a few minutes ago, CPAP. Could you describe what a CPAP is, what problems people have using a CPAP for sleep apnea? And before you answer me, I just want to remind everybody they're listening to Radio Hidabrut. This is 97.5 Health Watch. I'm your host, Dr. Jacques Dweck, and we're interviewing Dr. Brian Keropian, the inventor of the Full Breath appliance, which treats sleep apnea and, of course, snoring, and very effective against snoring. But right now we're discussing sleep apnea and the process of using a CPAP instead of the Full Breath appliance. How does that work? How does that CPAP work?
Well, first of all, the CPAP is medicine's number one treatment for this. And what the heck is the CPAP? CPAP is, if you've seen anyone, and you've seen them on television, deep sea diving, they've got the 2 oxygen tanks on their back, and then they've got a little mask that fits over, that fits over the nose and the mouth. But this one, the CPAP, has a mask that fits over the nose, and it's hooked up to a machine that produces pressure, and it shoots oxygen pressure up the line to this mask, and the high-pressured air goes into the nose, up the nose, all the way down the pipeline, the airway, and then pushes the tongue with enough pressure to push it forward. Now, the problem, it's very, very successful. Now, that's not the problem. The problem is, theoretically, the success is literally 95% and up. The problem lies that the pressure that it takes to do this is like sticking your head out of a car window at anywhere from 20 to 45 miles an hour. That's how the kind of pressure going up your nose. And people reject this. They don't like the confinement and feeling tied down with this mask tightened, because it's got to be tightened so that that air pressure doesn't go flying everywhere. And then the mask leaks and air will shoot into the eyes. The tightness of the mask causes the skin around the nose to be irritated, the skin over the bridge of the nose to be irritated.
Sounds pretty uncomfortable.
The inside of the nose dries out. I mean, there are a lot of reasons. And the rejection rate of the CPAP is 50 to 60%, and you will see mentioning in the literature in the 70s and 80%. So
people don't like to wear this appliance. I think about the appliance. My wife's aunt, she's in a nursing home, and we go to visit her, and she has at all times an oxygen hookup with tubes. And what she's wearing is a lot more comfortable than a CPAP, because the CPAP is a lot more hardware on your head.
Well, you're absolutely right, but if her tongue is rolling back, that air is not getting in. I mean, it's as simple as that. So that must not be happening, because if her tongue was rolling back and she wasn't getting the air, and they would be able to see that on the oximetry, which is that which measures the level of oxygen in your body.
Right. I don't know what she wears when she sleeps. This is when we go to visit her, and we're talking about Auntie Margie. She's a special lady. When we go to visit her, she's got her oxygen unit on, but she's sitting upright.
Okay, well then, you know what? During the day, her airway's open.
Right.
The brain doesn't let it close. or at least stay closed long, because the tongue's moving around all the time.
Exactly.
So Auntie Margie's got an open airway and delivering air back there to just help her body out.
But I don't know what happens when she's sleeping. You know, I never thought about that when she's sleeping, her tongue is rolling backwards, and who knows if the oxygen equipment is helping her.
Well, it might be real wise for you to run if they'll let you run a home, or maybe they'll do it. They'll run either they'll run the big sleep test, which is called the polysomnogram, or PSG, or you can run your little home sleep test. And it ain't such a, it's a big deal, the home sleep test.
Well, we care about Auntie Margie, so we hope we'll be able to do the right thing for her. So now, somebody who can't wear this appliance, and we've discussed already that the percentages are very high of people that tried to wear the appliance and couldn't. You know, I had one of my patients told me he really was not able to.
When you're talking the CPAP, that which pulls the jaw forward.
No, I'm talking about the CPAP.
Oh, the CPAP, okay.
The CPAP, they weren't able to use that, and he was so frustrated, he went and he had surgery done where they cut the whole back of his throat out to give him more room back there. Have you heard anybody do that procedure?
All the time.
Really?
You know what? Those procedures, what they would do is they would cut the little uvula that hangs down in the back. They cut that. Then they will go in to the back of the throat and with lasers, shoot lasers and literally almost cook that tissue a little bit to get it to shrink, to move backwards, to give a little more room. And sometimes they'll even cut part of the roof of the mouth away, and then even cut a little bit of the tongue. Now, these procedures were extremely popular from about the year 2000 to about 2006. But the problem was that the success rate after 6 months was about 30%.
Wow.
So with that, there was a great rejection on the part of the physicians to do it because they were getting too many patients coming back with failures and really not happy with the physician or the treatment that they got.
Well, 7 out of 10 failures doesn't sound like a very promising predictability.
No, well, matter of fact, what happened is I got a group out here in Los Angeles, a group of 5 ear, nose, and throat doctors that did a lot of the surgery. But then they started getting the failures started showing up. They started sending me the mouthpieces, and finally I was doing so much and getting so much success, they invited me to join them. So I work 1 day a week with an ear, nose, and throat group doing this.
Well, that makes a lot of sense.
Yeah.
Makes a lot of sense. So we talked about snoring and how people who snore can get a lot of help by being fit for a full breath appliance, which is, again, like a little bite guard that fits on the lower jaw. It was invented by Dr. Keropian, who we're speaking with right now. And basically what it does, it's like almost like a tongue depressor that pushes the back of the tongue down enough to allow air in to break the snoring. And another very important benefit is to let oxygen go down and oxygenate the body. So that's a tremendous benefit. And another thing is people with sleep apnea, and very many people who snore, and especially if they snore and they find that they're drowsy during the day, have the 2 classic signs of sleep apnea. They should consider having a sleep test done, or at least discussing it with their physician or their dentist, and finding out what could be done about the sleep apnea. So as we're interviewing now with Dr. Keropian, what other advice do you have for people who may have some concerns about snoring and maybe sleep apnea? What other advice do you have for them?
Well, the big advice is, look, we all want to live our next 10 to 40, 50 years healthy. We all want to keep away from sitting in medical waiting rooms because we have problems with our body. If you're not getting enough oxygen to your body, your cells and body are breaking down. And you have a much higher chance of being in that medical waiting room in 5, 10, 15 years because your body is just It is breaking down from lack of oxygen.
Lack of oxygen. The most important thing that we need every minute is oxygen. We need to constantly be oxygenated, and when we're sleeping, we need it just as much as when we're awake.
You're absolutely right. You know, there was a very interesting Nobel Peace Prize in the 30s. Otto Warburton was a doctor in Nazi Germany. He won 2 Nobel Prizes, and his prizes were based on the fact that when the body is highly oxygenated, it is healthier, a reduction of disease, virus, and cancer. And unfortunately, Hitler never let him pick up the second Nobel Prize. But his work is absolutely outstanding, and it set the tone for all this in the 30s. So what we're talking about is lack of oxygen is literally a physical destroyer. And we've got a chance to do something about it. I personally think this is dentistry's biggest frontier. The stuff that the dentists do with decay, with orthodontics, with gum disease, with root canal. I mean, this is tremendous stuff. It really is. But the stuff that we're doing with oxygen is life survival. Absolutely. And if we've got 100 million Americans snoring, wow, we've got and that's 56% of all adults. We've got a huge area that needs treatment to maintain a good lifestyle and maintain their energy and all the things that they want to do.
So if somebody wants to find a doctor or a dentist to help treat them with sleep apnea, what do they do? And if they need to get in touch with you, Dr. Keropian, how can they get in touch with you?
Well, I can be reached at area code 818-881-7233. You know what? Let me give you my toll-free number. I can't believe I gave you the wrong number. All right, toll-free. The toll-free number is area code 888-285-8038. And you can get in touch with the company for the mouthpiece is called The Full Breath, and anyone listening to this, we can refer you to doctors wherever you are. Obviously, Dr. Yusek handles our stuff in the Brooklyn area and that side of New York, but we have people everywhere to do this, and this is the basic of your health and survival for the next 20, 30 years.
Great. So if anybody is interested in finding out more information about the Full Breath appliance, they can call Dr. Keropian's number. It's a toll-free number, 888-285-8038, for information about how to stop snoring, how to eliminate snoring, and how to treat sleep apnea and get a better night's sleep, how be more refreshed during the day, stop annoying everybody with your snoring sounds, and live a healthier, happier life. I want to thank Dr. Keropian for joining us tonight. I want to thank everybody for listening. And if you have any questions or if you have any suggestions, you can get in touch with Dr. Keropian, 1-888-285-8038. And if you need to get in touch with Dr. Dweck, you can reach me at 339-7982. We have an upcoming interview next week. Please join us again Monday night. At that time, we're going to be talking to a specialist who is a medical doctor, but is also a naturopath, and we're going to hear some very nice insights into how modern medicine can help us and sometimes hurt us. Thanks very much for listening. This is Dr. Jacques Dweck, and thanks for joining us on 97.5 הידברות. Thanks very much.
רדיו הידברות, 97.5 FM